Today, we're going to talk about the anatomy of the neck so we can define things to understand the terminology of what we do a little bit better. Really, the neck is made up of 4 layers. There's the skin layer, which can be excessive. Then right under the skin, there's a nice protective layer of fat called subcutaneous fat. And I liken that to a down comforter that provides protection to the 3rd layer. The 3rd layer is the platysma muscle. That's a muscle that goes from just above our jawbone down like drapes down to our collarbone. And they have striations, kind of like flank steak on them. So that's why we call that 2nd layer of fat, that subcutaneous fat, protective, because it protects us from seeing the flank steak look of the platysmal muscle. The 4th layer is deep to that platysmal muscle, and that's filled up with the deep neck structures. That could be subplatysmal fat, which is fat that can't be liposuctioned, anterior digastric muscle bulging, which as we age, the muscles here in that part of the neck can bulge out a little bit and cause bulging, and the submandibular glands, little glands here that help provide saliva for our mouth that as we age can sag down. What we're doing in our neck lift is we're starting with the deep neck structures, getting the weight off the hammock of muscle by reducing the glands when necessary, reducing the size of the anterior digastric muscles, as well as reducing minimally the subplatysmal fat in the midline. Usually we leave that alone. Those are the deep components we start with. Then we work on tying together the hammock of muscle back again. That platysmal muscle, we recreate it and we release it so we can lift it vertically when it's time to lift. The 2nd layer, that subcutaneous fat, we leave alone. In general, we try and not reduce that unless it's absolutely necessary because it's nice and protective. And then the 1st layer is that skin. When we do our neck lift, a little excess skin will come out and be cut out from behind the ears.